It was a very well attended symposium, and it was sponsored by a company called Helsin, and they asked us to discuss a case of a young woman having chemotherapy for lung cancer and the complications that she developed during that journey. And there were a number of experts there, and it was very interactive, and it showed how if you can work as a team together with the patient, you can make a really big difference. Initially, she'd always had medical problems, and then she developed her cancer. And the first thing I think that we highlighted and the audience picked up was that the impact of what had been going on before her cancer had a huge relevance to the side effects she developed from her treatment as things went on. And this is often forgotten in cancer care. And actually, by bringing experts together who have different bits of armamentarium which they can provide, sometimes you can see the patient much more as a whole than as a lung cancer who needs treatment now with this. This woman had had irritable bowel syndrome all her life, and one of the side effects of cancer treatment is often quite upset bowels and diarrhea and bloating and wind. And there's definitely evidence from people who've had radiotherapy that if people who've got irritable bowel syndrome before they start the radiotherapy, they're off the scale of toxicity by the time they've finished the radiotherapy in general. And yet this is something that wouldn't normally be addressed because the cancer is important and all this IBS has been going on a long time. But in this woman, we highlighted this fact, and in fact it was really relevant to the problems she developed. And so I think one of the lessons that we came up with that actually this is something that needs to be thought about very routinely in these patients. And because it's difficult, and because perhaps some cancer doctors, or many cancer doctors, won't have that expertise to deal with irritable bowel syndrome, it's something they need to have very close links with gastroenterologists to be able to sort out in advance or to intervene when necessary. Treatment, it made very little difference. And I think that's one of the fantastic things about modern oncology, that it's very supportive and they have very good drugs to deal with the nausea and vomiting and the bone marrow suppression, but mitigation of side effects potentially had a huge role. We highlighted the need for multidisciplinary input, things which would often be ignored normally. So a second issue in this woman was her continuing loss of weight through treatment. And again, this is very often recognised in patients with cancer, but quite frequently gets ignored because it's a difficult issue and people are not quite sure what to do, and they don't always have the expertise how to intervene. So there were two experts on the panel who talked about that, and I think challenged the audience to think about it in a different way and make it much more integral to the kind of holistic care offered to that woman. Obviously the central person is the patient, because the patient needs first of all to understand what treatment is and what the options really are and the pros and cons of all the options. And people are at different stages. Some people are very intellectual and have read loads, other people find it extremely complicated. So the very first bit, and this came out from all the speakers at this presentation and discussion, that actually we need to involve the patient much more, and that some patients, just get given the information, get pushed out and say, which of these choices do you want to make? But that's not the right way to deal with it. So I think the very first and most important thing in shared decision making is how you involve the patient in a real way. But the second thing is to recognise that the patient is a whole, and they might have lung cancer, or they might have bowel cancer, or whatever has happened as a disaster, but they've had their life before and other medical issues, and that if you ignore that, that has a risk of detracting from the effectiveness of their cancer treatment. And so I think it was quite unusual in this panel that there was a gastroenterologist. So there are very, very, very few gastroenterologists who are interested in the side effects of cancer treatment, and that's much to the detriment of patients.